it would be good if you just set the scene for our viewers, and just say a little bit about where it is you're based right now and the types of projects that you're engaged with through the ICRC.
I'm based in Bamako in Mali. I'm the head of ICRC delegation there. I've been there for the last 3.5 years now. And we have a substantial operation ongoing in the Sahel region in general, but in Mali in particular. In Mali, we started operation back in the 90s, and we went all through the different crises, including the 2012 one, during which we stayed in Gao and in the north, taking over the hospital, etc. So we have a long history and an operational response history in Mali in general. Today, our main priority are on protection of civilian population. That means visiting detainees, having a dialogue on respect of international humanitarian law with all the actors, I mean the parties to the conflict. And second, that's the health response, our presence in hospital, taking care of war wounded people and other wounded, supporting health centers, having some psychological support for victims of armed conflict, including for victims of sexual violence, etc. So a large palette of activities, including, I didn't mention, water and sanitation, social economic program to support the population in Mali.
Given the fact that you're already based in Mali and the fact that the region was already requiring humanitarian assistance, what has been the biggest challenge presented by the pandemic in terms of the continuation of your work, but also obviously the prevention of the spread and treatment of anyone who's contracted the virus themselves?
There are a few challenges that we have to meet here in Mali and elsewhere in the world as ICRC. The first one is to make sure the information gathering that system that we have is still working. Around these pandemics, there have been so many informations and misinformation, whatever. It was very difficult to keep your head cool and to find out what is true, what is speculation, what is scenarios, and what is the actual situation. Second of our priority was to make sure that the health of our staff, the duty of care, was ensured. I mean, I have 500 staff here in Mali, all over the country, and my main concern was to think that they all are safe, including the one who, I mean, the people who are staying at home or working remotely was not the biggest issue. The biggest were for the people visiting detainees, people going in the hospital, and being closer to people at risks. Third was to ensure the so-called business continuity, to make sure that goods are still coming in from Côte d'Ivoire or from Niger, so that we can still travel within the country, so that we have the necessary humanitarian space that we needed. And fourth was to readapt or to refocus our response to the newly emerging crisis. I mean, the needs that were pre-existing the crisis were still here, but there were new ones appearing or emerging in hospitals, as I mentioned, or in detention center, where we had very strong interventions in terms of hygiene promotion, delivering support so that the virus didn't find its way through the detention places.
The BBC this morning, the numbers that I saw were, I think, 901 cases confirmed, and I think 54 deaths confirmed. Could you just help us understand those numbers? So firstly, do you think those are accurate numbers? And secondly, if they are accurate, they seem, for a population in Mali of 19 million, it seems relatively low. Do you read that as a good sign, that Mali should be able to keep the number down, or is this more, are these the initial stages of the spread and the worst could be yet to come?
Well, let me answer that question with a kind of provocative answer, saying by nature, all the numbers, especially in these pandemics, are wrong. By nature, they are wrong. I mean, we have only a part of the reality in front of us. In Europe, in Northern America, and in Africa, even more. The level of testing here in Mali is relatively low because the means to test too many people are not there. But from the onset of the crisis, the Ministry of Health, and this is something that we pretty much followed, to say we are not able to treat severe cases of COVID-19 if they are coming in numbers like in Europe, in terms of emergency healthcare beds, etc. We don't have the means. So we put all our efforts in prevention, social or physical distancing if possible, and making sure that the population understand the risks that are out there. So, and this strategy has been followed up to a certain extent. I mean, physical distancing in Africa is something very challenging. But on the other hand, some of this population have gone through Ebola crisis or other virus before. So they know how important it is to wash their hands. They know how important this is sometimes to take the necessary distance. Now, whether or not we have reached the peak of the crisis or are we plateauing, I don't really know. This is all speculations. We know that in Europe, in certain countries, there is a decrease in terms of cases. There is a kind of back to normal, expecting or not expecting a second wave. These are speculations too. Here in Mali, we have a certain level of cases. What reassures me is that even if they increase the number of testing, the number of positive cases didn't really explode. Figures that tends to reassure me. The second one is that even if we are present in many health center and hospital, we haven't seen any rush to the hospital or increase in numbers of people with respiratory diseases that would show a kind of a explosion of the number of cases. We haven't seen that. We haven't seen as well the explosion of number of deaths in comparison with other figures that we already have in Sahel. I mean, the mortality rate here in the region is already very high. The added numbers of COVID, you mentioned the 50 plus people who actually died over the last 2 months, it's really marginal in global terms. But I'm not saying it's over. I'm not saying it's something that we should underestimate. But we are, to a certain extent at the moment, not too bad in a too bad situation. What worries me the most, and maybe it will be part of our next discussions, is the side effect, the second wave, the economical social wave that will be much more impactful on Africa and Sahel region.
I just wanted to pick up on what you were saying about the fact that the Ebola crisis hit quite badly in the region before. How much of an impact would you say that makes to just the ease with which the message can be portrayed, with which for instance, in this country, social distancing took a while. I think no one really thought to do it. No one was kind of that prepared for a virus to spread. So do you think that could potentially be one of the positives that the African nations have over the European nations, is that they've already seen a pandemic, they already kind of know to a certain extent how to kind of react, how to stay informed of the procedures to take and things?
The physical distancing is an issue, and here in Africa, it has been an issue in Europe as well. If you remember the beginning of the crisis, I've seen images from France, Switzerland, and wherever where people were still gathering together in large numbers without really taking care of that. In Africa, it is an issue as well, and Mali was not that particularly hit by Ebola. There were a few cases, but in the neighboring countries they were. So they had this preparedness ready in terms of masks and some of equipment, and they knew that to respond to a virus like this, you need to increase the hygiene promotion, you need to increase social distancing, etc. But it was easier, I would say, to sensitize the people about what does that mean than it has been probably in Europe. Second, here in Africa, or at least in Mali, it is unthinkable to imagine to have a kind of lockdown like you have in Europe. Nobody's got a credit card, access to Amazon, Netflix, or whatever here. I mean, they need to go every day out to get their $1 or $2 to make their family living. So the choice of father or a mother or whoever in charge of small children here is to either go out to make the bread or earn the bread you need for the day, or to let your family die. And the choice is very quickly made.
You touched briefly before on the worry of a second wave in the sense of the economic pain that may be felt. People are talking of a global depression. I mean, how much does that directly risk the types of vital work that the ICRC are undertaking in places like Mali? How much of a concern is that for you?
As much as I'm not an epidemiologist, I'm not a global economist, but what I can say is globally we are worried as an ICRC that the global crisis, financial, economic, social, will have enormous impact, not only on our financing mechanism and the way we actually work, but the way the world will function. And countries like Mali, who already have social economic difficulties or landlocked, actually very much dependent on external help, both in terms of security, social and economical support. This kind of country will be very much at risk because they will probably be the first one who will take the wave of decreased money for development or decreased money for humanitarian assistance or external support, and with the dependence they have to the countries, the neighboring countries. I mean, we already see some difficulties in getting goods from the coastal countries like Ghana, Cote d'Ivoire into Mali because they are people. I mean, because a country like Mali or Niger are very much dependent on these goods.